Some of us can't fall asleep. Others wake up frequently throughout the night, while others wake up hours before their alarm. It's safe to say that not all sleeplessness is the same. However, what is the same is the crippling exhaustion that we all feel the next day, followed by frayed emotions and an inability to concentrate. One thing is for sure, you're not alone in your sleeplessness. An estimated third of the entire world's population has trouble sleeping. Globally, insomnia is the most common of all sleep complaints. Insomnia is defined by the American Academy of Sleep Medicine as trouble falling or staying asleep and daytime limitations caused by sleep problems. Sleep disorders can manifest in unexpected ways and can affect people differently. Characteristically, insomniacs have trouble obtaining adequate sleep, thereby affecting overall well-being. We will begin to highlight the different types of insomnia and their features. What are the different types of insomnia? Insomnia symptoms vary from person to person and can be described in several ways depending on features, duration, and length of time. These factors will indicate an acute or chronic case. 1. Acute insomnia. This type of insomnia is characterized by a temporary spell of sleeping troubles and is known as short-term or adjustment insomnia. Acute insomnia is typically triggered by a troubling event and stressful times, such as pressure from work or emotional issues. Acute insomnia can affect children and adults. Compared to men, women are predisposed to adjustment insomnia. Temporary bouts with acute insomnia normally resolve themselves in less than 3 months. Success is a little higher when the individual addresses the roots of triggers of this condition and adjusts to the problems affecting sleep. 2. Chronic insomnia. This type of insomnia occurs when the above acute conditions go unresolved for longer than 3 months or frequently in a year. When a person suffers from chronic insomnia, sleeping problems and subsequent daytime symptoms remain present. Without adequate rest, daytime exhaustion and difficulty staying focused begins to dominate one's work or academic performance. Additionally, this also puts a damper on one's social life. Naturally, those who suffer from chronic insomnia are also chronically distressed by their inability to sleep and function properly during the day. Chronic insomnia, like short-term insomnia, affects persons of all ages and is more common in women. 3. Sleep-Onset Insomnia. This type of insomnia is characterized by the inability or difficulty to initiate sleep for longer than 30 minutes. Sleep-onset insomnia reduces a total sleep duration, thereby impairing daily daytime functioning. Tossing and turning in attempts to fall asleep has been a common complaint of those suffering from sleep-onset insomnia. There are different causes of sleep-onset insomnia. Psychological insomnia results from increased mental and physical arousal. This pattern results in sleep-onset insomnia. Anxiety can cause a state of arousal and lead to insomnia. A sleep disorder called obstructive sleep apnea interferes with breathing, which makes it rather difficult to initiate sleep. Harmful sleep habits can contribute to insomnia. These include drinking caffeine too close to bedtime or inability to stay on a proper sleep schedule. An imbalance in a person's hormone levels has been linked with sleep problems. Hormonal imbalances includes a physiological change, such as menopause, which can affect a woman's ability to initiate sleep. Restless leg syndrome, RLS, is characterized by the involuntary jerking of one or both legs, while causing aches and cramps. Sleep onset is usually very difficult for those with RLS. Periodic limb movement is a similar condition, only it involves both arms and legs. Chronic heart failure is also a cause of sleep-onset insomnia. Sit tight, because we're going to continue discussing the different types of insomnia, including the causes and the manifestation of symptoms. 4. Maintenance insomnia. This type of insomnia, also known as middle insomnia, is characterized by the inability to remain asleep. People who suffer from this condition have difficulty staying asleep and will likely wake once or more during the night. They may also have trouble getting back to sleep after waking up. In turn, these sleep disruptions increase the likelihood of experiencing daytime tiredness. There are many causes of maintenance insomnia. Medical conditions related to the respiratory system, such as asthma or chronic obstructive pulmonary disease, COPD, can cause symptoms of maintenance insomnia. Other medical conditions such as Parkinson's disease and gastroesophageal reflux disease, GERD, can also disrupt one's sleep. Psychological or mental health problems such as depression, post-traumatic stress disorder, PTSD, and schizophrenia can negatively impact one's sleep quality. Just as in onset insomnia, unhealthy sleep habits contribute to a poor night's sleep. An improper sleep environment will increase arousal and stimulate you to wake up easily. If the room you are sleeping in is too noisy or too bright, this can negatively impact your sleep. Circadian rhythm, our internal clock, can be off-tempo and out of sync. Sleep rhythm disorders, like advanced sleep phase disorder, can make staying asleep problematic. Other sleep disorders, such as sleep apnea and night terrors, can cause or coexist with insomnia. 5. Early morning insomnia. This type of insomnia, also known as terminal insomnia, occurs when a person wakes up earlier than planned or desired. Anyone who suffers from this condition will typically wake between 3 a.m. and 5 a.m. and find it difficult to return to sleep. There are many causes of early morning insomnia. To start, mental health problems such as anxiety and depression are associated with early morning insomnia. Aging can be a factor, as one's duration of sleep decreases as they get older. Seniors are more likely to get up earlier than younger people. Sleep apnea and sleep rhythm disorders are also contributing causes. 6. Mixed insomnia. This type of insomnia describes a condition unlike others, such as early onset, middle, and terminal insomnia. Insomniacs frequently report changing symptoms, making it difficult to characterize their condition. These patterns occur because it is normal for people to struggle with more than one sleeping problem. 7. Comorbid insomnia. This type of insomnia is one that arises from physical or medical conditions such as pain, asthma, and depression. A better understanding of insomnia has resulted from advancements in research and medical science. It indicates that insomnia frequently has a bidirectional relationship with medical conditions like depression, and depression could also predispose one to insomnia. 8. Behavioral insomnia. This type of insomnia is peculiar in that it affects children between 1 and 5 years old who have irregular or inconsistent bedtimes. Children who sleep with a bed partner are more likely to develop this condition. If permitted to persist, symptoms can profoundly affect sleep patterns and become a long-lasting condition. Children between the ages of 3 and 5 require approximately 12 hours of sleep daily. However, kids with behavioral insomnia may get significantly less sleep. 9. Idiopathic insomnia. This type of insomnia is a form of sleeplessness that lacks a clear explanation, such as a medical or psychological disease. Sleep experts think stress can consistently stimulate specific emotional centers in the brain, such as the amygdala. However, recent studies suggest that the condition likely develops due to excessive brain stimulation. Other studies have shown that people with overactive central nervous systems tend to have sleep problems. 10. Paradoxical insomnia. This type of insomnia is a sleep disorder that presents itself as a state of misperception. A person will sleep through the night, but feel as if they have been awake all night. Its exact cause is unknown. However, paradoxical insomnia has been associated with hyperarousal states, such as anxiety. Sleep studies typically appear normal, unlike those with sleeplessness. Conclusion. The good news is, although insomnia is multifaceted and widespread, it is a treatable sleep disorder. If you are experiencing disturbances in your sleep, you should schedule an appointment with your doctor to address your symptoms and concerns. Help is available.